Hello, good evening, everyone. Welcome to another round of Microbiotics Bout Talk, and I'm your usual host, Ayo Fasun. And this evening we'll be talking about one of topic that was kind of like a break off from a topic that we treated the last time. And we'll be talking about nonsteroidal anti-inflammatory drugs, popularly known as NSAIDs. I'll be calling them NSAIDs for this evening. So if you hear me talk about NSAIDs, know that I'm talking about nonsteroidal anti-inflammatory drugs. These drugs are used in treating pain, fever, and other inflammatory processes. And we'll just quickly brush over the mechanism of action, the administration, the adverse effects, monitoring, and the likes this evening. Stay tuned. The next few seconds, we'll start again. So, as said, NSAID are some classes of drugs that are used for antipyretic, anti-inflammatory, and analgesic agents, and they are used in treating muscle pain, dysmenorrhea, arthritic condition, pyrexia, gout, migraine, all sorts of body pain that are due to inflammations, and most of the time they actually work. We have a lot of them. We have a lot of examples around us. We have aspirin, we have Diclofenac, we have Ibuprofen, we have so many others, naproxen, ozaprozin, and the likes. And the mechanism of action is actually to stop pain. We can go through all the talk about the mechanism that he used to work, but that's not really the purpose this evening. But as stated, it is actually very useful in stopping pains and fever, and we have both the oral one, and then we have the topical one as well. Most commonly anyway, NSAID usually comes in form of oral tablets. We have, of course, most of us are used to aspirin, most of us are used to ibuprofen, most of us are also used to diclofenac. So, but the topical one are also available, which are used in treating, let's say, ankle pains and stuff like soft tissue injuries and even osteoarthritis on the body. So, intravenous are also available, but they are usually administered under close monitoring, so that it won't lead to any adverse effect. And talking of adverse effects, we have a lot and lots of adverse effects, of course, of NSAID. We have gastric effects. It has effect on intestinal tract. It has effect on the kidney. It has effect. It has a renal effect. It has effect on the heart as well, cardiovascular issues. It has effect on the liver, hepatic adverse effect. It also has on the blood cells, which we refer to as hematological effect. And then we have other kind of effect that NSAID usually produce adversely. Of course, there are also contraindications for NSAID. NSAID should not be given to patients that has the hypersensitivity to the drugs, or patients who have experienced the allergic reaction after taking these drugs. So if you know you've shown allergic reaction to NSAID, any of these drugs, please avoid taking them. Then if you've undergone coronary artery bypass, which graft surgery, please, you are also exempted from taking this drug. And then if you are in your third trimester of pregnancy, please avoid taking any NZ. Of course, for those who are on it for a long time, the activity of the drugs are being monitored using renal tests, hepatic tests, and the likes, so that it won't there will be low risk for toxicity. The toxicity is actually very real, and people are trying to avoid such. So, but the toxicity usually manifests in different ways. It can manifest as gastrointestinal bleeding. It can manifest as in a form of hypertension. It can manifest in terms of hepatotoxicity. It can manifest also in terms of renal damage. That's a kidney damage. So, most of the time, the overdose is usually asymptomatic. Or it can show itself as gastrointestinal issues that one can ignore, but eventually it can get complicated and start manifesting as those things that we mentioned, bleeding, hypertension, and the likes. So the fun thing about this drug is that the general public uses these drugs because of all the things we've mentioned. Of course, if anybody has a body pain or fever, these are the drugs of choices. So it's very important that patients, especially you people that are listening, you must actually be very careful in taking these drugs. You must know the possible adverse effects. Please always read that white paper, that white sheet of paper that are folded inside any drug you buy. Look at the contraindications. Look at the adverse effect very well. If you know that you are susceptible to any of them, please consult your physician. And unfortunately, these drugs can usually be bought in pharmacy. They are on-the-counter drugs, so the pharmacies too. If you're a pharmacy, please, you have to educate your customers about the uses of these drugs. The adverse effect and the contraindication are also very, very important. So that's the end of this about talk. Of course, I hope it's been enlightening enough for you. So when next you look at your Diclofenac, you look at your Ibuprofen, just have it at the back of your mind that you are dealing with NZ and that you should be careful. If there's any other further question or inquiry that you need, of course, you can get across to us in Microbiotics. We are always ready to give you the right information at any time. So, like I always say, take care of your health and be careful about the drug that you use. Have a lovely evening and sleep well. Bye.